Welcome back to Good Day this Tuesday morning. All right, so we are wearing turquoise around here, and not just because it's a glorious color, but also because we are trying to bring awareness to women's lung health, which is something that I know personally, Dr. Cook, I have it's not even been on my radar. It's Women's National Women's Lung Health Week, and the idea is to bring awareness about lung health, but even for people who have never smoked a day in their lives.
Exactly. Thank you very much, Courtney, for inviting me here today to talk about this really important issue. Today I represent the American Lung Association in UC Davis. I'm the head of lung surgery at UC Davis. And what many people don't realize is that lung cancer has a significant impact on women's lives in the United States. Lung cancer unfortunately kills more women in the United States than breast cancer and colon cancer combined.
Which is a staggering statistic, especially when you mention it's like 3% of women who even have this on their radar. Most women don't think of lung cancer if they are not smokers. It's just not something that anyone honestly thinks about.
Exactly, and that's why it's important for things like this week, National Women's Health Lung Health Week, and Turquoise Takeover to really highlight that important fact.
So when you think of causes for lung cancer, obviously we think of cigarettes, but what are other causes that can relate or turn into lung cancer issues?
So the lion's share of causes for lung cancer is tobacco exposure.
Sure.
And so tobacco cessation is really important in that factor, quitting smoking. But there are other causes. There's genetic causes, so family history. There are environmental exposures, such as radon gas, as well as air pollution and other occupational hazards that can lead to lung cancer.
Okay, so if we know some of the causes, what are ways to avoid lung cancer?
Well, one way to detect lung cancer early, unfortunately, 75 of people who are diagnosed with lung cancer, 75% are diagnosed at late stages, where it's difficult to cure. With something called lung cancer screening with low-dose CT scan, we can screen those individuals considered the highest risk for developing lung cancer. And 75% of lung cancer in patients who undergo screening are diagnosed at stage 1 or 2, the earliest stages, the best chance for cure.
Okay, so screening is obviously the best way to go, preventative medicine.
Exactly. Screening is really top on one's health. The other is quitting smoking, and ask about radon. Is radon in your area, and can you detect it? And talk to your primary care doctor or primary care provider about what you can do to learn more.
Wonderful. Dr. Cook, it's so wonderful to have you here with us from UC Davis. And one of our very own, our newest member to the Good Day family, Dina Kupfer, has been directly affected, her family, by lung cancer. Her sister diagnosed at stage 4 by the time that they realized that that's what she had. Dina joins us live right now from UC Davis. Dina, tell us a little bit more about your sister.
Good morning, Courtney. Well, first of all, thank you to my Good Day family for giving me a platform to reach other families out there. My sister was diagnosed at the age of 37, never had smoked. As you heard Dr. Cook said, 75% of those who discover they have the cancer discover it so late in the game. And unfortunately, my sister found it at stage 4. She thought she had pneumonia. She went in January 2015. They did an x-ray of her chest. They thought it was pneumonia. A month and a half later, she was told she only had 6 months to live. She was a fighter. She made it a year and a half, and I'm so proud to know that she fought as hard as she did. But this platform is something that I think we can all take away from, because it's not something that was on our family's radar. And we learned a lot about knowing your family's health history and being your own best advocate for your health. That is the biggest takeaway that I know we received as a family, and her 7 children now carry on her legacy, and she certainly left a mark. But we're just hoping that by shining a little light on lung cancer today, we're wearing teal to try to really raise awareness, and you can make donations today. I'll be posting some of that information on my social pages throughout the morning, but certainly this is something that I think we need to talk a little bit more about, because as you mentioned, only 3% of people even have this on their radar, Courtney, and it is something that affects so many people here in the United States.